Hello everyone, my name is SAAD and welcome to .Inline Academy. Today we are going to learn about another topic under the general anatomy, that is bones, right? We will study about the functions of bone and we will study about the types of bones. Okay, so this lecture is especially dedicated to the first prof medical students. So without wasting any time, let's dive in. So yes, before telling you anything, let me tell you that what we call bone in medical, in biology. So we call bone osteon. Why? Because it is the word derived from the Greek word for bone. Okay, in Greek we call bone osteon and in Latin we call bone os, but we usually use osteon in medical. Okay, you must have heard about osteocytes, okay, the cells of bones, osteoblasts, the primitive cells of bones, right? So, and you must have heard about osteomyelitis, the disease of bone. So these all terms are having the word osteon, okay, so that means bone, they are related to bone. Okay, so bone is a connective tissue. So as other connective tissue like blood, bone is also a connective tissue, and which is made up of unit called osteocytes. The unit of bone is osteocytes, okay, and made mostly of calcium salt. So the calcium salt is abundantly deposited in bone. Abundantly. More than 90% of the body's calcium is present at bones, and the most abundant present salt is calcium phosphate, okay, and after that the calcium carbonate is present in less amount, and in some traces there are different salts also. So we can say that the bone is a reservoir of calcium and phosphate of our human body, right? Okay, so coming further to the functions of bones. So these are the functions of bone. Let me just tell you one by one and we will go through them in detail. So bone gives shape and support to our human body, okay, and any biological body, it gives shape and support. Bones provide surface for attachment for muscles through tendon, because muscle is attached to bone through a tendon, okay, like if it is a muscle and here it is bone, so it will be attached through a tendon, okay, belly kind of muscle. So bone provide protection. So bone provide protection. How? Example, skull. Under the skull, the cranium cavity, the brain is present. So the external skeleton of bone is providing protection to the brain. Okay. Bone manufactures blood cells. Yes, one of the important characteristics of bone. They form cells of our blood, like RBCs, WBCs, platelets. Yes, all these cells are formed inside bone and we will study it. Okay, so bone stores 97% of our calcium, body's calcium. 97% of the body's calcium is in bone and the rest is in blood and in, yes, right, in the muscles. So the function of bone gives shape and support to our body. Like if we don't add bones, we will be looking like this. No. Yes, we will be looking like this because our organs will be not having any support. They will be loose, fluffy, going here, going there. There will be no support to the body. The bones provide a support. That's why they are called as a skeleton. Okay, they act as a skeleton to provide a surface for all the organs of our body to have a support. Okay, and they act as a surface for attachment of muscles. What is the function of muscles? They provide movement, right? They contract, they relax, and they provide movement to any joint, to any part of the body. So let's take a classical example of knee, right? So this is a knee joint. If you don't understand it, for the orientation sake, let me tell you that this is patella, this is femur, okay, the lower end of femur, and this is the upper end of tibia. we are seeing it from the anterior side, a little lateral anterior side. So this is the muscle that is called quadriceps femoris muscle. Okay, the one of its end is coming here to patella. So the work of this muscle is the extension of the knee. Like if the knee will be bent like this, it will be flexed. So to bring it back, this movement is the main movement of this muscle. So to do that, it has to be attached to this bone, right? If it will be not attached to this bone, how this extension will be possible? So for that, this muscle is attached here to patella, and this patella is attached through a tendon called tendon patellae through this tibia. Okay, understand? So this complete setup will do the extension of knee. So without attaching this muscle to any bone or to the following bone, this movement will be not possible. Like for another example, let's take a bicep. Okay, the bicep is attached here at the forearm. So when we contract our bicep, this forearm is flexed. No, yes, it is flexed. So the movements of muscle, the function of muscle is sufficed when they will be attached to the bone. The bone provides protection. Yes, the bone at the skull, the cranium cavity, is protecting the brain, most vital organ of our body. It is protecting it. And the rib cage, the bones of the rib and the thoracic vertebrae at the back and sternum in the front, this is forming a rib cage. So this rib cage is protecting our heart, our lungs. Okay, so the bone protects. Bone manufactures blood cell. Okay, now you must be knowing that bone is having something inside them that is called bone marrow. Okay, what is bone marrow? So there is a hollow space present in between some long bones. Okay, and in this hollow region, bone marrow is there. So bone marrow is a fluid that is having abundance of hematopoietic stem cells. Okay, so what is this hematopoietic stem cells? Fresh name. You will study about this in detail in physiology, but here let me tell you that these are the stem cells. What are stem cells? Stem cells are the cells that forms some kind of cells of our body, that are the primitive cells of any cell of our body. Okay, you're getting it. Like for example, they can form the RBCs, they can form the WBCs, they can form the platelets. So they are the stem cells. Stem cells can be converted to any other type of cell of human body. Okay, in this case, the hematopoietic stem cells will be formed in RBCs, WBCs and platelets. So they are present in bone. Okay, when the hematopoiesis takes place, these cells are being formed here. These are RBCs, right? These are WBCs. This is a huge monocyte. So it will be formed here and it will be released to the blood. So this is hematopoiesis, formation of blood cells, which takes place under the cortex, inside the cortex in the bone marrow of blood. So bone stores 97% of our body's calcium. How it is stored? It stores like this: complex accumulation of calcium salts, that was calcium phosphate, calcium carbonate and other some salts. So this accumulation in the form of hive. Okay, hive like structure. You know hive, beehive, it is just like hive. So this was the accumulation of calcium. So it is accumulated in this manner, that is, it is providing strength to the bone. Okay, now let's come to the types of bone. Okay, types of bones. So when we are doing the classification of bone, we classify the bone on the basis of the region of the body in which the bone is present, according to the structure. What is the structure of that bone? Okay, and according to the development, how that bone is being developed, and according to the shape, what is the shape of that bone? Okay, so I repeat, we divide the bones, or we classify the bones according to region the region of the body in which they are present. There are two types, axial and appendicular. So when the bone is present in the axial region, the bone is in axial. If the bone is present in the appendicular region of the body, the bone is appendicular. So structure. What is the structure of that bone? Is that bone compactly arranged? The cells of that bone and the accumulation of salt in it is compactly arranged, or it is calcilously, means very far away like a sponge. Okay, so that is a calcareous bone. On the basis of development, how that bone is being developed in the fetus or after the fetus when the development phase is there, so how it is being developed. So there are of three types, membranous, cartilaginous and membranocartilaginous. When the bone is developed through a membrane, through a group of bone forming cells, a membrane is formed, and through that membrane the bone is formed. Okay, so this is a membranous development. So those bones are membranously developed bones. And second, it is a cartilaginous bone. A membrane will be developed, but that membrane will be formed in a cartilage first, and that cartilage will be formed in a bone. Okay, so it will be a cartilaginous bone. In this membranocartilaginous development, part of the bone, partially that bone will develop directly in the bone, and partially that means that it will develop in a cartilage, then it will develop in a bone. So it will be a membranocartilaginous bone. And the most simple is on the basis of shape. So on the basis of shape, there are long bones, there are short bones, there are flat bones, irregular bones, pneumatic bones and sesamoid bones. So what is meant by pneumatic bones? Here pneuma means air. Okay, so air, the bones which will be hollow from inside and will carry air inside them will be pneumatic bones. There are some bones which are having air in them, so there is a significance of that bones. I will tell you in the forthcoming part. So sesamoid bone. Sesamoid bones are the bones that develop extra, that are the extra bone that develop in our body. Okay, the extra bones that ossify in our body are sesamoid bones. So according to the regional classification, there is axillary and appendicular bones. Axillary bones are the bones that are on the axis of a human body, like the skull, the rib cage and the vertebral column. Okay, these three types of bone, all the bones of the skull, all the bones of the rib cage and all the bones of the vertebral column are at the axis of our skeleton. Okay, so these bones are axial bones. Now coming to the appendicular bones. So all the bones that are forming our appendices, our upper arms and our lower arms, are the appendicular bones. Okay, all the bones like humerus, radius ulna, clavicle, the back here, scapula, femur and tibia. Okay, on the basis of structure, compact and calcareous. So for this we have to understand what is the structure of a bone. So let's take a long bone. Okay, this is a long bone. If we cut it, okay, so we will find that this bone is having a very strong structure at the cortex. Okay, this is structure. Let me change the color of the pen. Okay, this structure, the cortex of the bone is very strong, is densely made. Okay, is compactly made, and the medulla, the inside of the bone is spongy. The inside of this part is spongy. Here we have done the LS and the TS also. So it is a block of bone. So you can see that this part is a very condensely made part, compactly made part. It is a cortex region and it is a compact bone. Okay, and the bone that is inside, this is the medulla of the bone. It is a calcareous bone, a spongy bone. So this network is called meshwork of trabeculi. These are trabeculi. Okay, the hollow space and these things, these are trabeculites. It is a meshwork and hence forms a trabeculized structure. Whether it is a real bones LS lateral section or longitudinal section, so you can see that this is having lot of air, lot of sponginess. It is a calcareous bone, and this part, the cortex part, is having a very dense structure, tight, very densely made. It is a compact bone. So okay, the cortex of the long bone is compact, and the medulla of the long bone and the ends, like this is the end of this bone, this is the end of this bone. Okay, it is a calcareous. Development. On the basis of development, these are of three types. I have told you. Membranous bones are the bones that ossify intramembranously. Okay, a membrane will be formed and that membrane will be ossified to form a bone. Okay, these are the bones that originates within sheet-like layers. Okay, membrane-like layers of connective tissues. Includes the bones of the skull, clavicle, sternum, mandible, maxilla, zygomatic. Okay, so these are mandible, maxilla, zygomatic. These are facial bones. And the skull bones, these are the membranously developed bones. Cartilagineously developed bones are the bones that ossify intracartilaginous. Okay, structure will be formed, and that structure will first form as a cartilage, and that cartilage will start to ossify from inside to outside and forms a bone. Okay, so this development usually occurs in the long bones, that are the limb bones, the bones of vertebrae, and the thoracic bones. Okay, in these bones the cartilaginous development is there, hence they are called cartilaginous bones. Few bones are there that follow both the development procedures. Okay, the processes rather, that ossify, that are membranocartilaginous, that these ossify partially membranous and partially in cartilage. These are clavicle and mandible. These two are the example of membranocartilaginous bones. Now coming to the last classification, that is shape. So on the basis of shape, these are long, there are long bones, short bones, flat bones, irregular, pneumatic, and sesamoid. So coming to the long bones are the bones that are long. You can understand, you can relate from the word. But what are the long bones? The bones of the limb are the long bones: humerus, radius ulna, the phalanges, the metacarpals. Now coming to the lower limb: femur, tibia, fibula, the metatarsals, and the phalanges of the leg, or rather the phalanges of the foot. So these are the long bones. Okay, they are long in structure, they are long in shape. Now on the opposite, the short bones, the bones of carpals here present at the wrist, the bones of tarsals present at the ankle and patella. Okay, these are short bones. Flat bones, as the name suggests, they are flat. Scapula is flat. Okay, the shoulder blades are flat. The thoracic cage, the rib cage, the sternum is flat, and the skull bones are also flat. If you see the skull bones, they are flat. Okay, so these are the flat bones. Irregular bones, as the name suggests, again, the bones that are having the irregular shape. Okay, the bones of vertebrae, the pelvic girdle, these bones are irregular. That's why they are called irregular bones. Okay, now the last is not the last, second last is pneumatic. Pneumatic, as the name suggests, I just told you what pneuma means. Pneuma means air. So these are the bones that will carry air inside them. Why the air is present inside them? To give lightness to that bone, to decrease the weight of that bone. So these bones are present at the front of the face. The frontal bone, okay, the sphenoid bone that forms the base of the brain, okay, the maxilla, the ethmoid bone. So these bones are pneumatic bones, they are hollow from inside. Okay, so they are responsible to lighten the weight of the complete skull. The another function of these bones are they do the conditioning of air that we inhale. These are paranasal bones. Okay, so the hollow area inside them are called sinuses. So they are the paranasal sinuses. These bones carry the paranasal sinuses. Okay, that conditions the air that we inhale. Sesamoid bones. The extra bone or bony nodule formed after the birth. Okay, so these are some special bones, or rather they are some extra bones that are formed in our body. Okay, some bones are default as patella. Okay, patella develops after the birth and are sesamoid bones. Okay, they forms in the tendon, this quadriceps tendon. Between the quadriceps tendon, this ossification of bones get occur and this patella is formed. Okay, pisiform bone is in the carpals. Okay, the last bone, the last means the most medial bone in your wrist that you can feel is the pisiform. That bone also ossifies after the birth. So these are the default bones, but there are other bones also that developed after the birth, but they were not needed. They were not main, but they were needed in the body, individual body, and they get developed. Okay, like for example, this is an X-ray. You can see this bone, this extra bone, and this is also extra bone. These two bones are developed in this individual after the birth, and they are not the main bones. This is an extra bone that is developed. So in this large X-ray, this is also a sesamoid bone. These sesamoid bones get developed after the birth. Okay, if they hurts, if they causes any problem in the body, they are surgically removed, but usually they don't cause any problem. Okay, so here we are completed. So it takes a lot of hard work to make these kind of presentation and lectures. So I request to please like and subscribe and show your support. Okay, thank you very much. This is Muhammad Saad signing off. Bye.